Let us discuss about graphites by A.B.Nash. Eruption on the skin, oozing out of thick honey-like fluid. Mucous outlets, eyelids inflamed with pustules, ears discharged moist, so places behind ears. Mouth cracked in corners, anus, eruptions, chin fissured. Nails grow thick, cracked, out of shape. Constipation, stools knotty, large lumps united by mucus threads. Diarrhea, stools. Brown fluid mixed with undigested substances, and if an intolerably festid odor. Saddened spont, inclined to weep, thinks of nothing but death. Especially adapted to persons inclined to obesity, particularly females who delay menstruation. Hears better when in a noise, when riding in a carriage or car, when there is a rumbling sound. Sensation of cobweb on forehead. Tries hard to brush it off. The chief leading characteristic of this remedy is found in its skin symptoms. Hoyne had expressed it nearly right. Eruptions oozing out a thick, honey-like fluid. It may be found on any part of the body, but is especially found on or behind the ears, head, face, genitals, or eyelids. I once treated a case of eczema of the legs which was of 20 years standing. It was in an old obese woman, and by the way, that is the kind of subject in which this remedy is found most efficacious. I gave her, on account of much burning at the feet, a dose of sulfur cm. In 2 or 3 weeks an eruption was developed all over the body which exuded a glutinous, sticky fluid. 1 dose of graphite cm, dry on the tongue, cured this as well as the eczema of the legs and left her skin as smooth as that of a child. This was years ago. Erysipelas sometimes takes this form, and in such cases recurs again and again. It will naturally occur to the physician that because of this recurrence, there is some soric taint which must be made by sulfur. But we must not make the too common mistake of thinking that sulfur is the remedy on account of its great antisoric powers. Or on the often misleading indication, when seemingly indicated remedies don't act because sulfur is not the only antisoric, and where graphites is indicated is not at all the antisoric for the case in hand. In short, we must not prescribe for sorrow, which is only a name after all, without indications any more than we would prescribe for the name scarlatina or diphtheria. Graphites is a powerful antisoric, as are also sorinum, lycopodium, causticum and many others. Symptoms must decide here, as elsewhere. In order to still further show the wonderful antisoric powers of this remedy, I will give another case from practice. A child 3 years of age had eczema capitis. Under allopathic local treatment the eczema disappeared, but soon enterocolitis of a very obstinate character set in. Then the regulars could not do that as they had the eczema. And after they had given up the case, pronouncing it consumption of the bowels, the homeopath myself was called in on the ground that he could do no harm if he could do no good, so they said. Case: child greatly emaciated, little or no appetite, very restless, and stools brown fluid mixed with undigested substances, and if an intolerably festid odor. Taking into the account the history of the suppressed eczema, I prescribed graphites 6 meters. Janachin, and in a short time a perfect cure was the result. Sorinum has a similar stool as was present in this case, but the eruptions of the two remedies are different. In this one corresponded to graphites, hence sorinum was ruled out. If this case of so long standing had not had the eruption, I might have thought of China on account of the extreme weakness from long continued rain or loss of fluid. For China is another remedy that has brown, loose, festid stools. So we must take into consideration all the case, sorrow and all. In chronic cases, in which graphites is likely to be the remedy, we may look for affections of the eyelids, of the same eczematous character as that found on the head, behind the ears, etc. Notice: eczema of lids, eruptions moist and fissured margins of lids covered with scales and crusts. In sulfur lids the margins are very red. All the orifices under sulfur are very red. Graphites leads all the remedies for eczematous affections of the lids. Staphylos aureus stands next, but of course special indications, local or general, or both, must decide. Graphites is one of our best anal remedies. We have given the kind of loose stool characteristic of the drug. This is, however, exceptional, for it generally tends to constipation instead of diarrhea. The stools are not enlarged, the lumps sometimes united by mucus threads and mucus often follow the stool. There is often eczema around the anus, and it is one of our best remedies for fissure ani. There is in these cases apt to be much pain after stool, and much soreness in anus on wiping it. Now if all this should occur in subjects of this tendency to sticky eruptions, we should not hesitate to give graphites with expectations of success. Another very characteristic calling for this remedy is found in the nails. Both finger and toe nails become thick, grow out of shape. Never forget graphites when you find this state of nails present. Again, graphites has cracks or fissures in the ends of the fingers, sarsaparilla, nipples, labile commissures, puffiness, and between toes petroleum. It is one of our best remedies for wounds found in persons of herpetic dyscrasia. Old, hard cicatrices soften up and go away under its action, especially those left by abscesses of the mammary. Lumps in the breast of suspicious appearance also go away under the action of this remedy. In menstrual troubles it resembles pulsatilla, but there are plenty of points to differentiate them. In temperament it resembles calcarea or styrum, but in graphites the menses are mostly scanty and delayed, in calcarea too soon and too profuse. Graphites cures complaints of many kinds when you have present two things. First, the peculiar tendency to obesity. 2d. The characteristic glutinous eruptions.